Most people think high blood pressure is just about salt. Cut the salt, take your pill, done. I wish it were that simple. After 30 years in cardiac surgery, I've seen what actually happens inside those arteries. The scarring, the stiffness, the way a heart quietly struggles for years before anyone notices. And I can tell you, there is a lot more going on than most people realize. Here's the thing. Medication is important. I'm not asking you to throw your prescriptions away, but medication alone is often only part of the answer. And the other part, most doctors simply don't have time to explain it during a 10-minute appointment. Today, I'm sharing 5 natural supplements that target the mechanisms your medication might be missing completely. Each one works differently. Each one hits a different weak point. And when you combine them, the results can genuinely surprise you. Stay with me, because by the end of this video, you'll understand your own blood pressure better than you ever have before. Let me give you a bit of background first. Blood pressure has been a problem for humanity for a long time, but it became an epidemic in the modern world, particularly for people over 60. Right now, nearly 3 out of 4 adults in that age group have high blood pressure. That's not a small number, that's most of the room. Now, medications, ACE inhibitors, beta blockers, diuretics, they do a real job. They block certain pathways, reduce fluid volume, slow the heart rate. They save lives. But here's what they don't do. They don't replenish what your body is missing. They don't reduce the underlying inflammation in your arterial walls. They don't fix the cellular energy deficit in your heart muscle. They manage the numbers. They don't always fix the machinery underneath. Think of it this way. If your blood pressure is a leaky roof, medication puts a bucket under the drip. Supplements help you patch the actual hole. Does that make sense? Have you ever wondered why your doctor never mentioned any of this? Drop a comment below. I genuinely love to know. Each of these 5 works on a completely different mechanism: inflammation, cellular energy, mineral balance, hormonal signaling, vascular tension. We're going to go through all of them one by one, and let's start with the one I consider the most important of all. Let's talk about magnesium, and I mean really talk about it, because this mineral gets mentioned everywhere, but most people still don't understand what it actually does inside the body. Magnesium is essentially a natural calcium channel blocker. Now, if you're on blood pressure medication, you may have heard that term before. Calcium channel blockers are a whole class of prescription drugs. What they do is prevent calcium from rushing into the smooth muscle cells of your artery walls, which causes those walls to tighten and constrict. Magnesium does something very similar. It tells your arteries to relax, to open up, to let blood through with less resistance. Here's the problem. Studies suggest that up to 60% of adults over 60 are deficient in magnesium. 60%. And most of them have absolutely no idea. Why? Because standard blood tests don't catch it. Only about 1% of your body's magnesium actually lives in your bloodstream. The rest is in your cells and bones. So, your lab work looks perfectly fine, and meanwhile your arteries are running on empty. Now, why magnesium glycinate specifically? Because not all forms are equal. Magnesium oxide, the cheap kind you find in most drugstore supplements, is poorly absorbed and will likely just give you a very unpleasant morning in the bathroom. Glycinate is bound to the amino acid glycine. It absorbs well, it's gentle on digestion, and glycine itself has a mild calming effect on the nervous system. That's a bonus when stress is part of your blood pressure picture. And for most people over 60, it absolutely is. Where do you start? A reasonable starting dose is around 120 milligrams before bed. The reason for bedtime is twofold. Magnesium has a gentle, relaxing effect, and nighttime is when your body does most of its cellular repair. You can gradually work up to 300 to 400 milligrams as tolerated, and always talk to your doctor first, particularly if you have kidney disease. Now let's talk about something that surprises a lot of my patients when I bring it up: Fish oil. High-quality omega-3 fish oil. People think of fish oil as a heart supplement in a general, vague sort of way. Good for the heart, sure, whatever. But I want to explain the specific mechanism because once you understand it, you'll never look at this supplement the same way again. Your arteries are not just passive pipes. They're living tissue, and like any living tissue, they can become inflamed. Chronic, low-grade inflammation in the arterial walls makes them stiffer, narrower, and far less flexible. And stiff, inflamed arteries mean higher blood pressure. It's that direct. Omega-3 fatty acids, specifically EPA and DHA, the two active compounds in fish oil, are among the most well-studied anti-inflammatory agents we have. Multiple clinical trials show they reduce arterial inflammation, improve the flexibility of vessel walls, and meaningfully lower blood pressure, particularly that top number that tends to climb with age. A 2022 analysis of over 70 clinical trials found that omega-3 supplementation produced consistent, measurable reductions in blood pressure in adults with hypertension. That is not a small body of evidence. That's decades of research all pointing in the same direction. Now, quality matters enormously here. Cheap fish oil capsules sitting on a warm shelf for 12 months are largely oxidized, which means they may actually increase inflammation rather than reduce it. That is not the result you're after. Look for a product that's third-party tested, stored properly, and contains at least 1 gram of combined EPA and DHA per serving. If it smells like a fishing boat, throw it out and get a better one. Your arteries deserve better than rancid oil. Do you currently take fish oil? Have you ever thought about the quality of what you're actually taking? Think about it and let me know in the comments. This one is close to my heart, literally. Coenzyme Q10 is something I take very seriously as a cardiac surgeon. CoQ10 is a compound your body produces naturally. It lives inside your mitochondria, the tiny energy factories inside every single cell. This job is critical. It helps convert the food you eat into usable cellular energy. Without adequate CoQ10, your cells simply can't produce energy efficiently. Think of it like this. Your heart beats roughly 100,000 times every single day. That requires an enormous continuous supply of energy. When CoQ10 levels drop, the heart has to work harder to achieve the same output. And a heart working harder under strain contributes directly to elevated blood pressure. Now here's the part that genuinely troubles me as a cardiologist. Statins, the cholesterol-lowering medications that millions of adults over 60 take every single day, block the same biological pathway that produces CoQ10, which means if you're on a statin, there's a very real chance your CoQ10 levels are significantly depleted. Your doctor prescribed the statin to protect your heart, but it may be quietly draining the very fuel your heart runs on. Are you on a statin? If the answer is yes, this supplement deserves your serious attention. Beyond statins, CoQ10 levels naturally decline with age anyway. By the time you reach 60, your body produces considerably less than it did at 30. The combination of age-related decline and statin depletion can leave your cardiac cells running on a dead battery. A major study published in the European Journal of Heart Failure found that CoQ10 supplementation in patients with heart failure significantly improved symptoms and reduced cardiovascular events. And for blood pressure specifically, several trials have shown reductions of up to 17 points in systolic pressure with consistent use. That rivals some medications. Typical dosing is between 100 and 200 milligrams daily, taken with a meal containing some fat. CoQ10 is fat-soluble. Morning or lunchtime works well for most people. Give it at least 8 weeks before judging results. This is not a supplement that works overnight. I need to stop calling vitamin D a vitamin because technically it isn't one. It's a hormone. And like all hormones, it regulates far more in your body than most people realize. One of the key systems vitamin D regulates is called the RAS, the renin-angiotensin-aldosterone system. That's a mouthful, I know. Here's the simple version. The RAS is your body's master blood pressure control system. It governs how much fluid you retain, how tightly your vessels constrict. Vitamin D acts as a natural brake on this system. When vitamin D is adequate, the RAAS runs calmly. When vitamin D is deficient, the RAAS can become overactive, driving blood pressure up. Multiple large studies have found a direct, consistent association between low vitamin D levels and hypertension. One analysis of over 300,000 participants found that people with the lowest vitamin D levels had significantly higher rates of high blood pressure. That's not coincidence, that's biology. And here's what makes this particularly relevant to you. Vitamin D deficiency is extraordinarily common in adults over 60. The skin becomes less efficient at producing vitamin D from sunlight with age. Many older adults spend less time outdoors, and dietary sources alone simply cannot provide enough. Research suggests that anywhere from 40 to 80% of older adults are either deficient or insufficient in vitamin D. That is a staggering number. Before you start supplementing, and I want to be clear about this, please get your blood levels tested first. A simple blood test measuring 25-hydroxy-vitamin D will tell you exactly where you stand. The target range for cardiovascular benefit is generally between 40 and 60 nanograms per milliliter. Many people need between 2,000 and 4,000 IU daily to reach that range. Some need more. But without testing, you're guessing, and guessing with hormones is not a smart approach. Take vitamin D3 specifically, not D2, and take it with vitamin K2. These two work as a team. Vitamin K2 helps ensure that calcium goes where it belongs, into your bones rather than depositing in your arterial walls. That's a pairing worth remembering. Most people have heard that sodium raises blood pressure. That part is well known. But what far fewer people understand is that sodium doesn't work in isolation. It has a counterpart, and that counterpart is potassium. Here's how the balance works. Your kidneys are constantly making decisions about what to hold on to and what to flush out. Sodium tells the kidneys to retain fluid, which increases blood volume and raises pressure. Potassium tells the kidneys to do the opposite, to excrete sodium and pull excess fluid out of the body. They are essentially on opposing teams. And in most adults over 60 eating a modern Western diet, sodium is winning that game by a very wide margin. Research consistently shows that increasing potassium intake produces meaningful reductions in blood pressure, particularly in people who are already sodium sensitive, which describes a large proportion of older adults. The effect is most pronounced when you address both sides of the equation simultaneously. Reduce sodium and increase potassium together. Now, and I want to be very direct about this, potassium supplementation is not something to approach casually. Unlike the other supplements we've discussed today, excess potassium can be genuinely dangerous. If your kidneys are not functioning optimally, they may struggle to clear excess potassium from the bloodstream. This can lead to a condition called hyperkalemia, dangerously high potassium levels, which can cause serious heart rhythm problems. This is why I recommend a food-first approach for potassium. Avocados, sweet potatoes, bananas, white beans, spinach, salmon, all excellent sources. Focus on getting potassium naturally through your diet before you even consider a supplement. And if you do consider supplementation, please have a conversation with your doctor and get your kidney function checked first. No exceptions. Here is something I want you to sit with for a moment. Each of these 5 supplements taken alone produces a modest effect on blood pressure. We're typically talking about reductions of 4 to 8 millimeters of mercury for any single supplement. That's real, but it's not dramatic on its own. But blood pressure is not driven by a single mechanism. It's the product of multiple systems working simultaneously: vascular tension, inflammation, fluid balance, cardiac output, hormonal signaling. Medication typically targets one or two of those pathways. That's why it sometimes isn't enough on its own. When you address all 5 mechanisms at the same time, something significant happens. Magnesium relaxing the arterial walls. Omega-3 reducing vascular inflammation. CoQ10 supporting cardiac efficiency. Vitamin D regulating the hormonal pressure system. Potassium balancing fluid retention. The combined effect becomes considerably greater than the sum of its parts. This is what I explain to my patients. You're not just taking 5 supplements. You're running a coordinated support operation on 5 different fronts simultaneously. And that's precisely why some of my patients have been able to have genuine conversations with their doctors about reducing medication doses, not eliminating them, but reducing under proper medical supervision with monitored results. Has your doctor ever talked to you about this kind of approach? If not, bring this video to your next appointment. Seriously. I want to address something directly before we move on, because I've been talking about natural supplements for several minutes, and I never want anyone to walk away with the impression that natural automatically means harmless. It does not. Magnesium can cause problems in people with impaired kidney function. High-dose fish oil can thin the blood, which matters enormously if you're already on warfarin, aspirin, or any other anticoagulant. CoQ10 can interact with blood thinners and may slightly lower blood sugar, which is relevant if you're managing diabetes. Vitamin D toxicity is rare but real if you supplement aggressively without monitoring your levels. And potassium, as I mentioned, carries genuine cardiac risk in the wrong circumstances. None of this means these supplements are dangerous for most people. They're not. For the majority of healthy adults taken at appropriate doses, these 5 are safe and well tolerated. But most people over 60 are not taking 0 medications. Most are managing multiple conditions simultaneously. And that's exactly the situation where you need professional guidance. Use this as a starting point for a real conversation with your doctor. Bring a list. Ask specific questions. That's how this information becomes genuinely useful to you. Here is something I don't hear discussed nearly enough, and in my opinion, it's the most important thing I'll say in this entire video. High blood pressure after 60 is not simply a plumbing problem. It's a signal. It's your body telling you that multiple systems are under strain simultaneously, and that those systems have probably been under strain for years before the numbers on your monitor finally gave it away. Medication suppresses the signal. That's valuable. It buys you time and reduces your immediate risk. But it doesn't address what's generating the signal in the first place. And that's the gap between managed numbers and genuine cardiovascular health that these 5 supplements are designed to help close. Here is what genuinely moves me after 30 years in this field. I have sat across from patients who were told their blood pressure was simply a fact of aging, something to manage, not something to meaningfully improve. And I have watched those same patients, with the right nutritional support, the right supplementation, and proper medical oversight, achieve blood pressure readings they hadn't seen since their 40s. Not everyone. I won't overpromise. But enough. Enough that I stopped accepting "this is just what happens when you get older" as a complete answer. Your cardiovascular system is remarkably adaptable, even at 65, even at 75. It responds to what you give it. The question is, are you giving it what it actually needs? That question is worth sitting with tonight. So, let's bring this together. 5 supplements, 5 different mechanisms, all working toward the same goal. Magnesium glycinate helps your arterial walls relax and open up. Start at 120 milligrams before bed and work up gradually. Omega-3 fish oil reduces the chronic inflammation that makes your arteries stiff and resistant. Quality matters. Don't cut corners on this one. CoQ10 restores the cellular energy your heart muscle needs to work efficiently, especially critical if you're on a statin. Vitamin D3 with K2 regulates the hormonal system that controls your pressure from the inside out. Get your levels tested before you start. Potassium, nature's sodium flush. Food first, always. Supplements only under medical supervision. None of these is a miracle on its own, but together, targeting 5 different pressure mechanisms simultaneously, they give your body a genuine fighting chance. That's not wishful thinking, that's biochemistry. Now, what's your next step? This week I'd like you to do one thing, just one. Call your doctor and ask for a vitamin D test and a basic metabolic panel. Those 2 tests will immediately tell you whether deficiency or kidney function should be your first priority. One phone call, that's it. You've spent decades taking care of everyone else. Your children, your grandchildren, your career, your home. It is not selfish to take 30 minutes this week to take care of your own heart. It is absolutely necessary. I genuinely believe that the people watching this video, people curious enough to seek out this kind of information, are exactly the people who see real results. If this video helped you today, please hit the like button. And remember, everything I've shared is general information, not personal medical advice. Your situation is unique.